Welcome to Professional Certifications channel. In this video, we're exploring Chapter 14 of ICD-10-CM 2025, which focuses on diseases of the genitourinary system, with codes ranging from N00 to N99. This chapter is essential for coders working in urology, nephrology, OB/GYN, and general practice, covering everything from kidney disorders to reproductive health issues. Let's dive into the details.
Section 1, Chapter Overview. Chapter 14 includes disorders of both the urinary system and the male and female reproductive systems. These conditions often require attention to laterality, infection type, chronicity, and sometimes pregnancy-related status. Key areas include kidney and urinary tract diseases, reproductive system disorders, infections like UTIs and STIs, menstrual, menopausal, and infertility issues.
Section 2, Key Code Categories. Let's break down the major categories in Chapter 14. N00 to N08, Glomerular diseases. Includes acute nephritic syndrome, N00, and chronic glomerulonephritis, N03. N10 to N16, renal tubulo-interstitial diseases. Includes pyelonephritis, N10, and hydronephrosis, N13.30. N17 to N19, renal failure. Acute kidney failure, N17.9, chronic kidney disease, CKD, stages 1 to 5 and ESRD, N18.x. N20 to N23, urolithiasis and urinary obstruction. Kidney stones, N20.0, ureteral obstruction. N25 to N29, other kidney and ureter disorders. Includes nephrogenic diabetes insipidus, acquired cystic kidney. N30 to N39, other urinary system disorders. Cystitis, N30.00, UTIs, N39.0, urinary incontinence, N39.3, N39.4. N40 to N53, male genital organ disorders. Benign prostatic hyperplasia, BPH, N40.1, prostatitis, male infertility. N60 to N77, female breast and genital disorders. Mastitis, ovarian cysts, N83.20, fibroids, N85.0, endometriosis, N80. N80 to N98, non-inflammatory female genital tract disorders. Menstrual irregularities, N92, menopause, N95.1, infertility, N97. N99, post-procedural genitourinary disorders. Infections, hemorrhage, or obstruction following urological or gynecological procedures.
Section 3, Coding Tips and Documentation Guidelines. Here are some important tips for accurate coding in Chapter 14. 1. Chronic kidney disease (CKD) is coded by stage, N18.1, N18.6, and is often linked with diabetes, E11.22, or hypertension, I12.x, so don't forget combination codes. 2. For urinary tract infections (UTIs), use N39.0 for unspecified site. For cystitis, use N30.x. 3. Laterality matters for conditions affecting kidneys, ovaries, testes, and fallopian tubes. 4. For BPH with lower urinary tract symptoms, use N40.1, and link to symptom codes like N39.41, urge incontinence if applicable. 5. Always verify if conditions like infertility, menopause, or amenorrhea are primary, secondary, or age-related to choose the correct code.
Section 4, Real-Life Coding Examples. Let's go through a few case-based examples. Example 1. Type 2 diabetic patient with CKD stage 3. Code, E11.22, N18.3. Example 2. Patient with recurrent urinary tract infection. Code, N39.0. Example 3. Male with BPH and nocturia. Code N40.1 or 35.1. Example 4. Woman with right ovarian cyst. Code N83.291. Example 5. Postmenopausal woman with symptoms of menopause. Code N95.1.
Section 5. Common diagnoses from Chapter 14. Here are some of the most frequently used ICD-10-CM codes from Chapter 14. N39.0, urinary tract infection, site not specified. N18.3, CKD stage 3. N40.1, BPH with lower urinary tract symptoms. N83.20, unspecified ovarian cyst. N95.1, menopausal and perimenopausal disorders. N92.0, excessive menstruation. N97.9, female infertility, unspecified.
And that's your complete guide to Chapter 14, Diseases of the Genitourinary System in ICD-10-CM. This chapter touches on many essential systems, so be sure to focus on staging, for CKD, infection site specificity, laterality, and post-procedural complications when coding. If this tutorial helped you, hit the like button, share it with your peers, and subscribe for the next episode. Chapter 15, Pregnancy, Childbirth and the Puerperium, 000 to 09A. See you next time.